5 investigates now, finding out how many people have received those rapid antigen tests for COVID-19 in Massachusetts. Following multiple requests for information, the state has added the numbers to the public dashboard.
And Karen Anderson tells us right now the numbers confirm the concerns raised last week by 5 investigates.
Now, for the first time, we know more than 62,000 antigen tests have been conducted here in the state, and we know the results. And those numbers raise even more questions about whether these tests are being properly used here in Massachusetts.
Antigen tests are great, but we don't want to use them in the wrong way.
New questions from the head of the Harvard Global Health Institute, Dr. Anish Jha, about a popular rapid 15-minute test for COVID-19. They're called antigen tests, different from antibody or the traditional molecular nasal swab. For the first time on Wednesday, the state published its data on antigen testing, showing 98% of more than 62,000 antigen tests conducted since May were negative.
That's a higher percent negative than I would have expected, and it makes me wonder exactly when and how are we deploying these antigen tests.
The state numbers confirm concerns raised by 5 investigates after we found lines of people outside a local urgent care recently, many of them telling us they were in line for a rapid antigen test, hoping to get clearance for travel or work. But 5 investigates found that's not the type of person the antigen test was intended for. The FDA authorized the Quidel antigen test for emergency use in May, but UConn was authorized for individuals who are suspected of COVID-19 by their healthcare provider within the first 5 days of the onset of symptoms, not for someone who is asymptomatic or expecting a negative result. Dr. Jha says the rate of false negatives from antigen tests can be 50% or more. Yet today we found more people lining up.
If you're feeling fine, if you have no symptoms and you get a negative test, that does not mean you're not infected. And it is not meant and should not be seen as a clean bill of health.
Dr. Jha says antigen tests will play an important role in surveillance if done on a regular basis on the same people in nursing homes and schools. He believes the state needs to do more to educate people about who these tests are for.
I think it's really important for the state to very clearly communicate if clinics are not using these tests appropriately, clearly communicate the right way to do these tests and when to use them.
Dr. Jha told us he'd like to learn more about just who's getting the antigen tests. We've asked the state for more information, including how many facilities are giving these tests, and if officials plan to make it more clear that antigen tests are not for asymptomatic people. A reminder, antigen tests cannot be used to get around the Massachusetts travel restrictions. Karen Anderson, 5 Investigate.